Hello, everyone. In today's session, we are going to discuss about personality disorders. So this is your fifth unit uh, here. So what exactly these personality disorders are? So according to American Psychiatric Association, personality disorders are long-lasting ways of perceiving, interacting with, and thinking about the environment and oneself that manifest in various social and personal contexts. So we can say this, these disorders are inflexible, maladaptive in nature, and these leads to significant functional impairment. Yes. So this will definitely interfere the life of an individual in every domain. Like even in the previous session also we discussed, whenever we consider this as a disorder, that will impair the efficiency of an individual at different levels in life, like at their personal life, that uh, unusual behavioral pattern influences, or we can say that that will uh, uh, interfere. Yes, these unusual behavioral pattern interfere their professional and personal life. So here also in personality disorders also we can see this maladaptive behavior significantly influence the life of an individual. So these personality disorders, we can see they originate at childhood, like as Freud said, childhood experiences. Yes. So through this childhood experiences or traumatic experiences, we can say personality development will start right from this unusual behavioral pattern of personality starts right from childhood, originates at childhood, and exhibits its effects at the later life. At the adult life, we can see the effects. After effects, we can see at this adult age. So these are these personality disorders, or whatever way the maladaptive behavior, whatever we are talking about, they what we can say, they are very deep in nature, deeply ingrained, and making their onset hard to pinpoint. We find it difficult, like what could be the reason, when it started, how it started. Yes, it's difficult to pinpoint these origins. Then these maladaptive traits, because it's a personality, trait is a personality. So trait is a basic, what we can say, unit of a personality, yes, a single characteristic. So these traits, these maladaptive traits, which evolve over time into behavior, they become the behavioral pattern. So that causes the distress and attract attention. People do understand it is not normal behavior. Yes. Uh, for example, if you take this, okay, anyhow, we will discuss about. So yes, they do attract the attention of people, and it definitely this will affect all aspects of person's life. So overall, if we observe, a maladaptive behavioral pattern is developed at the childhood, and this will exhibits at the adulthood, and people can observe it easily, and this distress will interfere their people's day-to-day life. So if you see, for example, if someone has a paranoid personality disorder, there are various disorders. One among this is paranoid personality disorder. And it is overly suspicious. Paranoid personality disorder is nothing but it's a over suspiciousness. And this trait impacts the employment. Yes, it's a professional life. How it is affects the professional life? People, due to this distrust, yes, they can't trust their co-workers or people around in the work area. Yes, because of that, because of this distrust, people frequently change their jobs. Yes. And if you see this, they even struggle with their personal relationships. They can't sustain, or they can't uh, work on like long-term relationships. Yes, due to trust issues. So personal and professional life definitely going to affect due to this personality disorders. So in this, if we observe DSM-5, according to DSM-5, it classified personality disorders into three distinct clusters. Yes, even yesterday also, even in the previous session also, we discussed like even if we discuss about the causes, or previous session we discussed about anxiety disorders. So there is a systematic classification to explain about these unusual behavioral patterns. Yes. So likewise, here in the personality also, DSM-5 classifies all these personality disorders into three clusters. So cluster is a group. Okay. So under each cluster, again, we can observe different personality disorders. So those clusters are cluster A, cluster B, and cluster C. We will discuss in detail now. So cluster A. Cluster A, this first group is an odd and eccentric behavior. Yes, unusual behavioral pattern. Eccentric is the person who behaves odd or unusual way. Yes, so they don't follow the societal norms or rules and all these things. So we can easily observe this unusual pattern of their behavior. So in that, first in cluster A, we can see the first personality disorder as paranoid personality disorder. So this paranoid personality disorder, if you see the clinical definition for this is, it's a pervasive distrust. What we can say here, distrust. People can't trust anybody. So this can be spread all over. It's not like people are not trusting only family members or at the professional place. No, it's everywhere. Wherever the person is going, he finds difficulty to trust people. Yes. So pervasive distrust and suspicion of other, such that their motives and motives are interpreted as what we can say. So people definitely thinks that because of this distrust, people strongly believes that other people going to harm them. Yes. So they always in a thought that this distrust originates because their belief system that they strongly believe people are going to harm them. So this can begin at, as we discussed, this can begin at earlier adulthood and present in a variety of contexts. So if we observe these symptoms here in this paranoid personality disorders, symptoms can be like chronic mistrust, that's a basic nature, and suspiciousness. Then they are very hyper vigilant. Yes, they do observe, keenly observe each and every act of an individual. Yes, they try to supervise, they try to observe everything. And they find difficulty maintaining the relationships because they keep on think about what other person is thinking about them, whether they are planning against them or what. Yes. So they find difficulty maintaining the relationships. And they often have this hostile and detached behaviors. Yes, they always try to avoid people. So according to DSM-5, if a person displays 4 or more symptoms, yes, whatever we discussed, like suspicious behavior and preoccupied with unjustified doubts, or about their loyalty or trustworthiness of their friends or family members or associates, then we can say that reluctant to confide others. Yes, they're just not ready to listen what others are saying. They strongly believe what they are thinking about. Then persistently they bears the grudges. Yes, everything they hold that grudge and they try to maintain that. Then they always try to read that hidden demeaning or threatening meanings. They don't see anything as a normal or usual conversation. Always try to find what could be the reason. Yes, why this person, if a person offering any help, So these people will be doubtful why this person is offering help. What is the motive behind? Yes. So why this person helping me? So these are their continuous persistent thoughts and feelings about others. So what could be the reason for this personality disorder? If we observe the reasons or causes, etiological factors, uh, if we observe possible genetic predisposition could be there, then higher prevalence among relatives. Yes, if any family members has this, so the same personality disorder can run into the families. So if a person, like for example, if any of the family member has a schizophrenia, yes, or so this can run into the families. Then early childhood experiences that might develop mistrust, and socio-cultural factors also can be responsible for this kind of personality disorder. Then if we see the treatment, yes, so treatment for personality disorders is bit complex, but still by applying different therapies and pharmaco medicines and other things, we can to some extent reduce the symptoms. We cannot completely eliminate the disorder, but to some extent we can reduce the symptoms. So treatment can be like uh, we have to help the person to build the trust. Yes, by therapeutic techniques, we mostly focus on how a person can build trust over others. So for this, again, we can use CBT, which focuses more on challenging and modifying stressful thoughts, mistrustful thoughts, and assumptions, whatever the person irrational thoughts or feelings or assumptions of holding, we can uh, slowly we can unfold those belief systems. Then antidepressants also can be useful. So this both CBT and antidepressants, if prescribed to the patient, so to some extent we can resolve these issues in the person. Then the second category under cluster A is schizoid personality disorder. So this clinical definition for this schizoid personality disorder is a pattern of detachment. Yes. So in the first personality disorder, main feature is a distress. Yes. That's the reason because of this mistrust or distrust, they avoid people. That is the main feature. Here in schizoid personality, we do observe that it's a uh, it's a detachment from relationships and a restricted range of emotional expression. Mostly these people won't ventilate their emotions. Yes, they are very, we can say that these people are very cold in expressing their emotions. Yes, so they detach from social aspects, like they won't mingle with people, they don't ventilate their emotions or thoughts or emotions, we can say that. So it's difficult for them to maintain interpersonal relationships again uh, because they are incapable in expressing the emotions or unable to uh, unable to deal with the social aspects. Then if we observe the symptoms of this schizoid personality, majorly we can observe this social withdrawal, then preference for what we can say alone activities. Yes, solitary activities, like whatever they are doing, maybe it's related to completing a project or assignment within the organization, they usually prefer to work alone uh, over working with a group. Yes, so mostly we can observe this social withdrawal and solitary activities. Then the major another symptom is limited emotional expression. So most of the times these are aloof and detached. Again, if you observe the criteria, out of all this, if a person experiences or we can say that display four or more these symptoms, then we can consider this as a schizoid personality disorder according to DSM-5. Yes. So the symptoms, the criteria, if we observe, it's like these people neither desires nor enjoys the close relationships, even it is a family members or something. Then almost always they choose this alone activities, solitary activities. Then these people has little, or we can say there's no interest as in having sexual experiences with another person. Then these people takes pleasure in few activities, very few activities they people will have a pleasure. Then these people lacks close friends, or they don't share this confidential information with any of another person. So any four or more symptoms, if the person displays continuously over a period of time, then we can qualify this as a schizoid personality disorder. So again, if you observe the causes, etiological factors for this schizoid personality disorder, here again we can see that we can link to potential genetical factors like to schizophrenia, then environmental factors like family background, or what we can say, the war-like situation or people around, yes, and what kind of early childhood experiences they might have faced. Like uh, we can say that if people are lacking the resources, or there's lacking the family love and affection, yes. Mostly if we observe that people who raised in organizations like orphanages or somewhere where they never ever come across to love and affection or warmth or that touch, yes. So these people will usually develop this distrust towards other individuals. Yes. So these people have no clue, because they never observed other people who are expressing the love and affection with them. So they are very, we can say they are lacking this ability of expressing the emotions with others. So these could be a main reason, like environmental factors and genetical factors can be a major cause for this schizoid personality disorders. And again, if we observe the treatment, again here therapy focuses on developing the social skills. So therapeutic goals, if we observe over here, it's majorly focuses on how we can develop this, how a person can develop the social skills, how they can interact with others, how they can express their emotions or thoughts or feelings. Yes. So we can say most of the times to express these emotions, group therapy will work out better. So here they can slowly, eventually develop this interpersonal relationships. Slowly they can develop this, what we can say, trusting others and all. So it's quite difficult. Actually, it's a challenging, we can say. Yes, this task, this success of this therapeutic technique is quite challenging here, because these people will have this intense mistrust towards other individuals. So it will take a longer sessions or therapeutic, what we can say, duration. Then the third personality disorder in cluster A is schizotypal personality disorder. So this schizotypal personality disorder, if you observe the clinical definition, here it is a pattern of social and interpersonal deficits marked by acute discomfort with and reduced capacity for close relationships, as well as by cognitive or perceptual distortions, and it's what we can say, so perceptual distortions here. In the first disorder, what we observe here, that is suspicious behavior, mistrust. Second one, schizoid personality. It's totally about lack in the social relationships and expression of emotions. And here, adding to these 2 points, yes, addition of this is cognitive distortions. Yes, so cognitive distortions are nothing but people do experience these hallucinations and delusions. So hallucinations are, it's like, what we can say, it's even though the object is not present in the reality, people do experiences it. So these hallucinations are auditory and tactile, yes, visual. So there are five sensations. So we can say that. Uh, so this is a false perception. Yes, hallucination is nothing but false perception. People are perceiving something which is not in real. Then hallucination is a false belief. People start believing that, people falsely believe that there is something happening. So they'll be constantly worry about, like, they strongly believe that people are going to harm them or something. So even after there is an absence of real threat. So we can say that schizotypal personality disorder is associated with social anxiety, odd beliefs, or magical thinking. There's hallucinations, delusions. We can call it as a magical thinking. Like people always uh, like perceive something, they believe something which is not existing. So unusual perceptual experiences, they do experience this unusual cognitive aspects, or they perceive something which is not real. And so all these are the symptoms. A schizotypal personality, a person who has this schizotypal personality experiences. So according to DSM-5, individuals must display at least 5 or more symptoms out of this. So if we observe again the symptoms, overall criteria related symptoms, here it is like ideas of reference. So what kind of ideas a person possesses, like excluding these delusions. Then odd beliefs or magical thinking that influences their behavior and is consistent with subcultural norms. Yes. Then unusual perceptual experiences, including bodily illusions or thinking and speech. Then we can say suspiciousness or paranoid symptoms. Then inappropriate or constricted affect. So these are the symptoms uh, given by DSM-5. So if a person qualifies 5 or more symptoms out of this criteria, then we can qualify a person as schizotypal personality. So here if we observe the causes, again, uh, the factors, etiological factors lies at genetical, again, the genetical factors plays a major role. So here, these factors, along with, they can significantly overlap with schizophrenia spectrum disorders. Yes, there is a wide category of schizophrenia disorders. So these symptoms can overlap with. So another thing is neurodevelopmental abnormalities also can be responsible for this disorder, and early environmental stressors. Yes, as we discussed, there are various like societal pressures, or we can say like political, societal, or war-like situations. So if a person go on exposed to this, so these stressors also can be responsible for this kind of disorders in an individual. Again, for the treatment, we can use this CBT over here, cognitive behavioral therapy. We can use to improve the social skills. Then antipsychotic medications also can be helpful for this, treating this perceptual thoughts and disturbances in an individual. The next, if we observe, it's a cluster B. So in cluster A, there are 3 personality disorders. And in cluster B is about dramatic. Cluster A is an odd, unusual pattern of behavior. And cluster B is about dramatic or emotional behavior. So here mostly the behavioral pattern is very dramatic in nature or very emotional in nature. So in that, the first personality disorder is antisocial personality disorder. So for clinical definition for this antisocial personality disorder is it's an pervasive pattern of disregard for and violation of the rights of others occurring since the age of 15 years. So frequently they try to violate the rules or norms of the society, or they harm the other individuals. Yes. So they break the rules. So these are the major definition for it. So if we observe the symptoms for this antisocial personality disorder is disregard for social norms. Yes, they don't uh, give any importance to social standards or norms or rules and regulations. So they ignore or disregard for the social norms and laws. Then the actions, whatever they are taking, those are always they try to keep the truth hidden. Why they are doing it? Yes, what is the purpose? What is the motive behind? Then, so why they hold this? Just to get some advantage. Yes. So we can observe the impulsivity, then irritability, aggressiveness, and lack of remorse for whatever they are doing. So these are the major symptoms we can observe in this. Then criteria, DSM-5 criteria, if we observe here, according to DSM-5 criteria, if they uh, if they possess 3 or more symptoms, then we can qualify the disorder. So here the symptoms the criteria can be failure to conform to social norms with respect to laws, lawful behaviors. Yes, if they failure to conform to social norms with respect to lawful behaviors repeatedly, then repeated lying, yes, or we can say like cunning others for personal profit or pleasure. Then impulsivity or failure to plan ahead. If we observe this continuously, irritability, aggressiveness, so these are the indications. So these are the indications for the repeated physical fights and assaults. Then reckless disregard for the safety of their own self and as well as for others. So if they are driving, they drive very rashly, yes, recklessly, without thinking about their own safety as well as others. Yes. So overall, they just violate the social norms. So they are not trustworthy. Then consistent irresponsibility. This can be like this irresponsibility indicated by repeated failure to sustain consistent work behavior or honor financial obligations. Yes, if they promised to pay some debts or something, they frequently uh, uh, what they fail to sustain those promises. We can say that. Then we can observe continuously the lack of remorse. Yes, there is no guilt for their actions. So this indicate that these people, what we can say, they are like rationalized uh, while hurting the others or mistreated or stolen from another. There is no such kind of we just don't observe any kind of remorse or guilt in them. So these are the criterion DSM-5 criteria symptoms. So if a person continuously, persistently exhibit 3 or more symptoms out of this, then we can qualify this as an antisocial personality disorder. So the causes again, if we observe here, it is again lies in genetical genetical factors. So genetical factors is one. Another one is neurobiological influences. For example, low arousal level. That's the reason they don't feel any guilt towards their actions. Yes, there is no such arousal in them. So there's a low arousal levels, or we can say impaired fear conditioning. Yes, whatever they are doing, they don't associate with it. If for example, if a person is worried about the consequences for for their acts, they can think about like what is right, what is wrong. But these individuals are lacking that association with fear. Then we can say another factor is adverse childhood experiences. Maybe these children are abused or neglected. So these factors, neurobiological factors or genetical factors or childhood experiences do play a significant role in this. Then again, if we discuss about the treatment procedure, again, it is difficult to treat because they lack this remorse, they lack the guilt. If the person is not ready to accept for their acts, the behaviors, then it's difficult to treat that individual or make that person understand what they are doing. So these people are again highly manipulative. Even they can manipulate the treatment procedures also. But uh, we can uh, uh, we can focus on managing therapeutic session can focus on managing this impulsivity and aggression throughout the therapeutic sessions, and medications also can be associated with it. Then certain programs can be organized which target this substance abuse and behavioral issues, and we can say like which can benefit the behavior of an individual. So overall, we are providing certain training, how to control their aggression, how to control their impulsivity. So by providing this treatment and associating with medication, we can observe certain improvement in their behavioral pattern. Then second disorder in cluster B is borderline personality disorder. So clinical definition for this borderline personality disorder is, here we can observe a pervasive pattern of instability in interpersonal relationships. Again, it's about self-image and affects and marked impulsivity. So symptoms, if we observe here, intense fear of abandonment, like people may ignore them or people may abandon them. So this intense fear will be there in these people. Then unstable relationships, then identity disturbances. They do have doubts about their self-image. Then impulsive behaviors, they are unable to control their behavioral acts. Then mood swings we can observe over here. And we can observe this chronic emptiness, yes, and self-harming behaviors also we can observe in these disorders. So DSM-5 criteria also follows all these symptoms. So if a person follows three or more symptoms out of all this, then yes. So here 5 or more symptoms should be followed. So here mostly we observe criteria is, it's like so we can see this people are more we can observe more excitement, passion, fear, pain to avoid this real or imagined abandonment. Yes, they are experience continuously, they think about whether people will abandon, ignore them. Then a pattern of unusual, unstable and intense interpersonal relationships we can observe, which characterized alternating between extremes of idealization and devaluation. Then self-image and unstable self-image and sense of self also we can observe. Then inappropriate intense anger or difficulty controlling anger, we can see over here. So if a person qualifies 5 or more symptoms out of this criteria, we can qualify this person. So qualify the individual as possessing borderline personality disorder. Again, the causes are lying at genetical factors. Genetical predispositions are responsible, and early trauma and abuse can be a reason. Then we can say neurobiological factors, which can affect their emotion regulation, and we can say that environmental factors also responsible. So more or less, if we observe, all the personality disorders are the causes are lying at genetical factors, uh, neurobiological factors, and environmental factors. Yes, and childhood trauma. So these are the major etiological factors which can contribute this various spectrum of personality disorders. Then here, for this borderline personality disorder, dialectic behavioral therapy, DBT is very effective. So it is very popular to treat these borderline personality disorders. So here DBT focuses on emotion regulation. Yes, if we observe the differentiation between CBT and DBT, CBT mostly focuses on training the social skills, yes, and altering the cognitive distortions, or we can say that irrational thoughts or feelings. But DBT mostly focuses on emotional regulations. Yes, how they can control the emotions or manage their emotions. Or we can say that this again focuses on interpersonal effectiveness, how they can maintain good relationships with others. Then this again focuses on distress tolerance. Yes. Then here in CBT and DBT, we can see this will associate with mindfulness training also. So here, along with this DBT training, if medications are associated, then we can to some extent manage this mood swings and what we can say comorbid symptoms. Okay. Then another personality disorder which comes under cluster B itself is histrionic personality disorder. So this histrionic definition for this histrionic personality disorder is again here this is a pervasive pattern of excessive emotionality and attention seeking behavior. Yes, so pervasive pattern is nothing but this is spread all over. They try to seek attention from every other member. Yes, it's not like only from we do all in our day-to-day lives to try to seek attention from one or two individuals who are close with us. But especially in people who possess this histrionic personality, they try to seek attention from each and every individual, as they want to be center of attention. So the main reason for this distress in them is this lacking of this attention. If they are unable to get that attention, that will lead to distress or maladaptive pattern of behavior in them. So if we observe the symptoms for this histrionic personality disorder, excessive need for attention is a major symptom of this disorder. Then again, inappropriate seductiveness or rapidly shifting emotions, then we can say that most dramatic behavior we can observe over here. So to gain that attention, people do all sort of things, yes, through emotions, through their actions. So most dramatic behavior we can observe this histrionic personality. So if we observe this DSM-5 criteria, so individuals must display at least 5 symptoms out of this. So here it is like uncomfortable in situations in which they are not center of attention. Then interaction with others is often characterized by inappropriate, sexually seductive, or we can say provocative behaviors. They, whatever the reason, they want the attention from others. Yes. Then their interaction, sorry, what we can say, these people display rapid shifts in their emotions. Yes. If they are gaining that attention, they are very happy, joyful, enthusiastic. But if they are not gaining, the next moment, their their emotions will shift from positive to negative, or from that high to low. So, they always, what we can say, consistently, these people use as physical appearances to draw attention. Yes, not only emotions, not only behavior, they try to maintain their figure. Their physical appearance is very important for them to gain that attention. Yes, to draw that attention, they maintain themselves. Then we can say that these people will, so if we observe the way these people communicate with others, they always try to impress. Yes, their behavior is just to impress others. So, which lack the details. They don't focus on the information, what they want to communicate. Instead, they focus on how to impress others. Then they focus on relationships to be more intimate than they actually are. Yes. Then these people, suggestible, like these people are very easily get influenced by others. So there are various what symptomology. So if a person, out of all these symptoms, if they qualify 5 or more symptoms persistently, continuously, all over their life, like at personal, professional, or everywhere, persistently, then we can consider this as an histrionic personality disorder. Again, causes are more or less similar. So here it is genetical factor, family dynamics, and like people in the family dynamics, like we do observe that people always look for approval. Yes. So cultural variations do influence over here. Then treatment, if we observe, psychotherapy can be useful over here, which can focus on developing healthier ways to gain attention. Yes, they always tries to gain the attention, but they will train in psychotherapy. They will train how to seek this attention in a healthier way. Then how to maintain their self-esteem, and they address certain underlying emotional needs. Yes. Then we can say they do through this psychotherapy, they do try to improve their interpersonal relationships. Then the next category is about narcissistic personality disorder. So the clinical definition, if we observe for this narcissistic personality disorder, again, it is a pervasive pattern, like it's spread across, yes, every aspect in a human life. Like, yes, so it's a pervasive pattern of grandiosity. There's a major symptom of this disorder. So grandiosity is nothing but fantasy behavior. So these people fantasizes. Here in histrionic personality, the major symptom is seeking attention. They always try to draw the attention from others. But here we do observe that it's a grandiosity is the major symptom over here. It is like fantasizing behavior. So these fantasizing behavior need for admiration, or, and we can say, lack of empathy. Yes, this is associated with lack of empathy and need for admiration. So symptoms again, if we observe these symptoms, fantasy, grandiosity is a major symptom, then lack of empathy, then what they look for, need for admiration from others, then sense of entitlement and exploitative relationships. So these are the major symptoms we do observe over here. So again, if you read this DSM-5 criteria, there are again, these symptoms are elaborated. If a person consistently exhibits these symptoms, then we can qualify the disorder. So admiration requires, why these people look for admiration from others? This requires as a sense of entitlement, or we can say that it's and uh, they are interpersonally uh, exploitative. These people are very much exploitative to get the admiration from others, and these people lacks, we discussed, lacks empathy. So again, if we observe the causation, same underlying reasons we can discuss over here, like genetical factors, or we can say that family plays a major role over here. Family dynamics plays a major role over here. Childhood experiences. So therapies, treatment procedures, if we observe, again, CBT can be useful over here. So they can show, they can train them how to be like, how to reduce their fantasizing or imaginary behaviors or something. Yes. So this is about all these disorders comes under your unit 5. And if we discuss about unit 6, so unit 5 all about personality disorders, cluster A, B, and C. Then unit 6, it talks about mood disorders. So again, mood disorders, if we see the characterization, what exactly the mood disorders are. Mood, if we observe, like if we have to define what exactly mood is, it's an individual's subjective emotional state. Yes, it's an it's an person's subjective emotional state. So mood disorders are characterized by significant and persistent disturbances in mood, and we can say that mood disturbances, and these moods are maladaptive in nature. Those are unusual. Yes, mood patterns, or managing, controlling of these mood factors are maladaptive or unusual. So these disorders range from the extreme sadness of depression to the, what we can say, one pole of mood is extreme sadness, and the another pole of mood is about the joyful. Yes, the joy or pride we can experience this over here. So DSM-5, if we observe this DSM-5, which categorizes these mood disorders into those with only depressive symptoms and those with manic symptoms, like associated with uh, depression and manic. So what we call is bipolar disorders. One is depressive symptoms, another one is bipolar disorders. So these mood disorders are differentiated. Yes, how we can differentiate these mood disorders is based on their severity, how intense they are, and the duration, how long, how persistent these symptoms are exhibited by an individual. So uh, under these mood disorders, first we can discuss, like, these are more common compared to this personality disorders or schizophrenic disorders. And mood disorders are more in women compared to men. Yes, 2:1 ratio we can take. If two women are suffering, then yes. So yes, in this mood disorders, first, if we take this depressive disorders, the clinical definition and criteria for depressive disorders are These involves again persistent feelings like continuous feelings of sadness and loss of interest in usual activities. People do lack interest in their usual activities. And according to DSM-5, these depressive disorders are classified as major depressive disorder and dysthymia, that is chronic depression. Okay, usually people lack interest in their day-to-day, into their usual activities. Once people enjoyed those activities, now they are not. For example, a person enjoys doing their professional work earlier. Now the person is not liking it. Yes, he lost interest in it. So disliking that work. So this can be due to this depressive disorders. So major depressive disorder, if we observe the criteria, here it is a sad mood or loss of pleasure in usual activities, whatever they. So if the symptoms, whatever they are exhibiting, at least 5 symptoms, if they qualify in that criteria. The criteria is sleeping too much or too little. Then psychomotor retardation or agitation. Weight loss we can observe, or there is a change in appetite or loss in energy, or we can say that feeling of worthlessness or excessive guilt people will experience. Then difficulty in concentrating, thinking, or making decisions. These people experience recurrent thoughts or suicidal thoughts or death-related thoughts. So if these symptoms are present nearly every day, most of the day, or we can say at least 2 weeks, yes, difficulty in concentrating, disturbance in their appetite, or we can say that weight loss, or feeling of worthlessness, suicidal thoughts, so feeling of sadness, loneliness. So all this, out of all these symptoms, if they qualify 5 and persistently they exhibit throughout the day for at least 2 weeks, then we can consider this as a major depressive disorder. So etiological factors, the causes can be involved in the combination of genetic, biological, and psychosocial factors. So if a family has a history of depression, can be a reason a person might develop this. Then neurotransmitter imbalances, these chemical imbalances in the brain, particularly low serotonin levels, also responsible for this. Then psychosocial factors, which include negative thought patterns and personality traits like neuroticism, also responsible for this mood disorders. Then social factors, if we observe, it is like lack of social support, then interpersonal conflicts and stressful life events are responsible for it. If we observe the treatment procedure over here for this depressive disorders, the treatment typically includes a combination of pharmacological and psychological interventions like CBT, or then antidepressants are very much useful over here. So mindfulness-based cognitive therapy along with medication can improve the symptoms. The next one is bipolar disorder. So the clinical definition for this bipolar disorder is this bipolar disorder characterized by mood swings that include emotional highs. Yes, once the person is very happy, joy, yes, they experience this mania or hypomania, we can say. And suddenly they experience lows like depression. Yes, high and low. That's the reason it's called bipolar. So two different poles. So there are different types in this bipolar disorder. Bipolar 1 disorder, if we observe, it's defined by, we can say, manic episodes lasting at least 1 week. Yes, this high and low mood swings will continue for at least 1 week. Then we can call it as a bipolar 1 disorder. Then bipolar 2 disorder characterized by hypomanic episodes and major depressive episodes. Yes, hypomanic is high levels of energy, then suddenly fall in the energy. Yes, so these frequent episodes depressive episodes can be considered as a bipolar 2 disorders. Then cyclothymic disorder. So cyclothymic disorders is a fluctuating of mood, mood disturbances, then we can say which involves numerous periods of hypomonic symptoms and depressive symptoms that do not meet the criteria of a hypomanic or a major depressive symptom. Yes. So the major symptoms here, if we observe in all these 1, 2, and 3 categories, so this during this manic episodes, individuals mostly may experience this elevated or what we can say irritable moods, then increased energy and activity, then inflated self-esteem and grandiosity. Yes. Grandiosity, we already discussed, the term itself is known as fantasizing. Then discrete, we can observe over here because of this mood disturbances, there is a lack of sleep. Yes, people do decrease in their sleep cycles. Then flight of ideas or racing of thoughts will be there. Then distractibility we can observe in people. These people engage a lot of risky behaviors. So again, causes more or less the same. Treatment also more or less same here. CBT and pharmacotherapy can be useful over here. Then the last uh, mood disorder, the disorder which comes under this mood disorder is suicidal. Yes, suicide. So clinical definition for this suicide is, it refers to the act of intentionally causing one's own death, or suicidal ideation involves thoughts about self-harm or ending one's life. Yes, they frequently try to end their own life. So while these suicide attempts include the behaviors which aimed at causing death, but do not result in death. So they always try to attempt for death or attempt for suicide. So the common symptoms or signs which include in this suicide is, it's like uh, expressing feelings of hopelessness with no reason. Yes, they find no reason to live. Then talking about wanting to die or kill oneself, and they here we can see increased use of alcohol or drugs. Then withdrawing from social activities or isolating themselves very frequently from family, friends. Then we can observe this extreme mood swings in a people. Then we mostly observe that people usually give away those gifts or prestigious awards or something. Yes, whatever they achieved in their life. So because they find there's no reason to live, so they try to give away to others. Then if we observe the reasons, yes, reasons for this suicidal tendencies is, there are multiple factors contribute for this suicidal behavior, which include this mental health disorders, such as if a person go on experiencing this depression or bipolar disorders or schizophrenia, these people do have the suicidal thoughts as a comorbid symptom for this. Then these people who have this substance abuse disorder, this also can associate with this suicidal behaviors. Then if a person has this history of trauma or abuse, also develop this. Then we can observe like major life stressors in an individual, such as the loss of a loved one, financial difficulties, or relationship issues. These people also eventually develop this suicidal thoughts. Then usually people who lack social support, generally lack social support, or we can say whoever persistently experiences the feelings of isolation, they too develop this suicidal tendencies. So prevention, if we observe, then cognitive behavioral therapy is very much useful. So here mostly they focus on problem solving behavior, how they can solve how they can solve their problems,